So you've got a patient with thyroid cancer on your schedule. What do? Start with the oncology history. Now, ideally, you're getting this information down before you actually see the patient, aka in your chart review. This includes any treatments that your patient has undergone, as well as any treatments they will undergo for their thyroid cancer. As you're going through this, make sure that you're documenting dates, as in when they started that treatment, when they finished that treatment, how many treatments they got, any kind of dosing information if that's available to you, and any complications that that patient experienced as a result of that treatment. Even if you don't fully understand what these are or any specific side effects of these cancer treatments, this process will help you start to identify what are some potential side effects and impairments your patient could be experiencing as a result of that cancer and that cancer treatment. And again, ideally, this is all happening before you even lay eyes on the patient. I really encourage you to do as much of this as possible before you actually see the patient, because not only does this help you cut down on the time that you spend in the evaluation getting this information, documenting it, but it also saves your patient from having to retell their cancer origin story for probably the 700th time. I don't actually want you to start with all that information we just talked about, and here's why. I want you to connect with your patient, with that human who is sitting in front of you. I know it's really tempting to pull out that chart and then get your patient to reconfirm exactly what you have already gone over right away, but I don't want you to do that yet, because what we need to do is really work on establishing that therapeutic alliance between you and your patient so that they know they're in good hands, but also that you are going to help them accomplish what they're here for. So instead of grilling them immediately on all of their cancer history, here's what I want you to do instead. Get really, really clear on what your patient is experiencing and what brings them in to see you today. Then ask your patient how that experience, whatever that is for them, is affecting their ability to do what they love, what they need to do with the people that are important to them. And then I want you to ask your patient how their life would change if they could snap their finger and that would go away entirely. You should start your thyroid evals, and every other eval for that matter too, with these 3 questions, because they center the person at the heart of your session instead of their cancer diagnosis or their impairments. And that is absolutely the bare minimum we should be doing when it comes to establishing a really strong therapeutic alliance with our patient. Next, I want you to consider approaching this eval like a head and neck cancer eval. Now, I know I have said this before and I will say it again. Thyroid cancer is not a type of head and neck cancer, okay? Those are 2 different camps, but for the purposes of when you're constructing and when you're carrying out your evaluation, there's actually a lot more crossover than what we think. Now, geographically speaking, our thyroid is in the head and neck region, or at least the neck region, right? And so we can anticipate that our patients could very well experience some similar side effects, symptoms, and impairments for their thyroid cancer treatments that we may even see for their head and neck cancer treatments. Once you've identified what your patient is experiencing, how it's affecting their life, and how their life would change if that thing was no longer a problem, it's time to dive into the actual evaluating and assessing of this patient. So what I encourage you to do is assess cervical, thoracic, and shoulder mobility and function at bare minimum. So what I encourage you to do is to assess cervical, thoracic, and shoulder function, range of motion, mobility, etc. Because even if we're not totally looking at all the different impairments your patients could experience, that's a good chunk of what may be happening locally. Now, of course, your patient may experience more global impairments. Thinking about cancer-related fatigue is a big one that comes to mind, right? We know there's other big picture impairments your patients could experience, but if you're at a loss on where to start, this here is a really good place to start, because that's going to cover a lot of the more local impairments your patient could be experiencing. Next up, I want you to screen for quality of life. In a 2020 systematic review by Walshaw et al., thyroid cancer survivors reported that they felt their cancer diagnosis was trivialized and deemed not as important or not as big of a deal because it was, quote, a good cancer, as in Good cancer is how their family members, their support networks, and even sometimes their healthcare providers would refer to their thyroid cancer. And what this led to is that these thyroid cancer survivors didn't feel like they were being taken seriously, and their concerns were not even acknowledged by both their support networks, but also by their own healthcare team. This led to patients reporting that they didn't feel seen or heard by both their support networks and their healthcare team. This is unacceptable. There is no good kind of cancer. There's only cancer. And cancer sucks all day, every day, forever and ever. Amen. Like always and forever is going to suck. But most importantly, at the heart of this is that our patients deserve to feel heard, seen, valued, believed every time that we encounter them. What else would you add to this list? What else do you want to tell the OncoPT who is seeing their very first patient with thyroid cancer? Comment below with your thoughts so that way we can all show up better for the next time we have a patient with thyroid cancer on our schedule. Thank you so much for watching this video. I really, really appreciate your time, and I know that you're going to enjoy this next video that I've got queued up for you here. Until next time, this is Elise with the OncoPT, and remember, you are exactly the physical therapist that your patients with cancer need. So let's get to work.